Pneumonia. So I know everyone has known someone who's had pneumonia before. If y'all see me fangirling about these topics, it's because I remember in nursing school learning these topics, and now with me teaching them, I just love learning respiratory. Like respiratory is just one of my favorites. Respiratory or and cardio. So if you see me on these slides, like what is she so excited about? I just love talking about these things. So, what is pneumonia? Pneumonia is a lower respiratory tract infection that causes inflammation to your alveolar sacs. So, what is your alveolar? That's what I'm saying. It is so important you go back to your anatomy. So your alveolar is where your lungs and blood exchange oxygen and carbon dioxide while you're breathing in and out, right? So this infection inflames your air sacs in one or both lungs, because you can have pneumonia in one lung and not in the other one, in which could cause it to fill with pus or fluid. All right, so as you can see, let me grab my laser. As you can see, in a healthy airway right here, but as you can now see that small airway with pneumonia, germs, white blood cells, and mucus. So normally, the respiratory system can fight off these types of germs by filtrating the air taken in through the nose and the airway, but certain conditions can damage the body's ability to do so, and this makes the body more susceptible to developing pneumonia. So before I get into the signs and symptoms of pneumonia, what are some risk factors for developing pneumonia? So if you have a prior infection, the cold or the flu, a weakened immune system. So you remember we talked about in the other slide that guess what? Your body is normally able to fight off all this stuff. But if you already have a weakened immune system, your body is not fighting how it normally should. If patients are immobile for a while, this could be if they, due to their mental status, due to them being in a hospital, not being able to move around, not being able to mobilize secretions and stuff like that, that can lead to pneumonia. If you got lung problems, asthma, COPD, this puts you at risk for that. And post-op patients, if you have had a surgery where it especially abdominal surgery, if it's keeping you from breathing, taking deep breaths in and coughing and stuff like that, then that could put you at a risk for pneumonia as well. So these germs get into the lung by you breathing in, aspiration, or from blood, and they attack your sacs, right? And we already said that your sacs become inflamed and they fill up with pus, germs, and white blood cells and bacteria. All right, so what is your patient going to be complaining of? So your patient may be complaining of they have a cough. So they will have a productive cough, right? Of it like this in the box. It says that yellow blood streaked rusty sputum gives you an infection, right? Just nasty looking sputum, right? Your patient will have a fever, right? Because now the body is trying to fight off this infection. Chills, tachycardia, tachypnea, shortness of breath, pleural chest pain, and that is chest pain that is caused by coughing or breathing. They could have neural changes, especially your elderly patients. They may not even have a fever, but their fatigue and increased respiratory rate. Elevated labs, remember that their CO2, they will be retaining carbon dioxide, right? So the patient could have increased white blood cell count, right, because of the infection. Patient may be nauseated and they may have some vomiting because they won't feel like eating. Their oxygen saturation could be decreased in this patient. They could have decreased breath sounds. They could be complaining of joint pain and aching all over their body. So you want to be aware of different things, because pneumonia can show up in different ways. They may have activity intolerance, not really being able to do a lot because they get short of breath. So those are definitely some things that you want to keep in mind. Yeah, so that's that. So that's what your patient would be looking at. So remember, a productive cough. Germs are just everywhere. You see how the germs are all in their lungs, and they even got some fluid in their lungs. So what breath sounds? Let's see if you guys know what breath sounds. Does it say it on the slide? Let me see. No, it said decrease. But what type of breath sounds would you expect to hear when you listen to your patient? What type of breath sounds? Okay, I'm not going to tell you guys, but I want you guys to look it up and figure out what type of breath sounds would you expect a patient to have if they have any type of fluid building up. All right, so we have two types of pneumonia. We have a community-acquired pneumonia, and we have hospitalized acquired pneumonia. And the difference between is just when you contracted the germ. So with hospitalized acquired pneumonia, this is going to develop within 42 to 72 hours after admission. So I didn't have pneumonia until I got in this hospital. That's the only difference. It's just the location. All right, so how is pneumonia diagnosed? It can be done on chest x-ray. It can be done on sputum culture as well. All right, so one of the things I want you guys to go back and review, you should have learned it in pharmacology, but how do you collect a sputum sample? All right. All right, so what are we going to do for patients with pneumonia? So basically, one of the things that I want you guys to know for nursing interventions is always assess. Always make sure that you're assessing and you're monitoring your patient's respiratory status, making sure that they're using their sinus spirometer, right? Do we know what a sinus spirometer is? We will go over it when we do chest tubes and all that stuff when I go through different equipment. But making sure they're using the sinus spirometer, making sure that they're staying hydrated because we know that hydration thins the mucus. Making sure that patient is walking, mobilizing those secretions, right? Walking around, mobilizing those secretions if they can. Especially, you want to make sure that your patients are up to date on their flu and pneumonia vaccines. You want to educate them to stop smoking if they are. They want to avoid sick people. And then you also want to teach them to always wash your hand, wash your hand, wash your hand, wash your hands. But as a nurse, as far as the treatment part, I'm sorry I got off, but that is education of educating your patient, right? Now, how are you going to treat pneumonia? It's treated with antibiotics. So I'm a patient to be on it. I'm a IV antibiotics. So a patient will be on IV antibiotics for a couple of days, then the doctor will transition them to PO antibiotics and they'll be discharged, they'll be good to go home. So antibiotics, right? But then we want to treat the symptoms. So if the patient has a fever, we want to treat the fever. If the patient has pain, we want to treat pain. If the patient has a cough, we want to give something for the cough. If patient has mucus, we want to treat the mucus. So basically with pneumonia, you can have so many medications because you have so many signs and symptoms, right? So we want to treat those signs and symptoms as well as the antibiotics. All right, making sure that you always have suctioning at the bed. Anytime a patient has respiratory issues going on, most of the hospitals they have suction set up in every room. But you want to be that super nurse when you do your admission. You know that your patient coming in with some type of respiratory issue, go ahead and set up your canister and get your yonker and all that stuff set up, because in an emergency situation, you don't want to have to be running to go get that. You want to already have it set up ready to go.